Welcome, everybody. It's a pleasure to have you here with us today. My name is George Molina. I'm a surgical oncologist and a member of Latino Surgical Society. As many of you know, for those of you that have joined us before, and for those of you joining us for another time, the Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons. And today's event is in line with this mission. I want to thank our institutional members, our platinum members, gold, silver, bronze, and all of our members. These are institutions that have invested in the society and make a lot of these programs available and possible. And we really thank those members and all the residents, staff, and trainees at those hospitals. We also have a few events that are coming up. I don't think we have slides for these, but I just want to make you aware that Latino Surgical Society really is striving to have events throughout the academic year. And we're trying to meet our members at our specialty meetings. The Society of Surgical Oncology is having our meeting next week in Atlanta, Georgia, and we'll be having an event on Thursday, the 21st. So please look at your emails. We're promoting this event on social media, on Twitter. And if you're going to be attending SSO, we would love to have you. We also have other events as well that happen throughout the academic year, including these sessions. And we'll have a robust calendar for that as well. And so please look out for all the events that we'll be posting. And we love to engage with everyone and make sure that these events are for you, the members. Now I would like to introduce the session moderator. For many of you who have attended these sessions, we have our guest speaker who, and then we invite a moderator, usually someone in training, to interview our guest speaker. So I'm going to go ahead and introduce our moderator, and then our moderator will go ahead and introduce our speaker. Dr. Carlos Teddy Huerta is a clinical PGY3 resident in general surgery at the University of Miami Jackson Memorial Hospital. He's an aspiring pediatric surgeon scientist. He received his medical degree from the University of Kentucky before attending residency within the University of Miami DeWitt Daughtry Family Department of Surgery in 2019. Completed his postdoctoral research fellowship within the laboratory of Dr. Omaida Velazquez, our speaker today, and Zhao Jun Liu, where his focus was on the creation of translational cell-based therapeutics, utilizing mesenchymal stem cells to treat ischemic wounds and augment tissue revascularization associated with chronic limb-threatening ischemia. Dr. Carlos Huerta, welcome. And I give you now the virtual podium.
Thank you, Dr. Molina, for that introduction. And thank you to the Latino Surgical Society and all of the planners for putting this session together. It's my great pleasure and honor to introduce my great mentor, Dr. Omaida Velazquez. Dr. Omaida Velazquez was born in Cuba and emigrated to the United States to Union City, New Jersey in her early teens during the Mariel Exodus, thereafter becoming a U.S. citizen. Despite going to a public high school with limited resources, she excelled academically and went on to earn her Bachelor of Science at the Stevens Institute of Technology and then attended UMDNJ, Rutgers, New Jersey Medical School, where she graduated valedictorian. She earned her general surgery residency and subsequent fellowship in vascular and endovascular surgery at the University of Pennsylvania. There, she also pursued 2 years of formal postdoctoral research training at the Harrison Department of Research, University of Pennsylvania. She next joined the Penn faculty and served there for 8 years, rising from assistant to associate professor with the award of tenure at the University of Pennsylvania. Dr. Velazquez relocated to Florida in 2007 when the University of Miami recruited her as the chief of the vascular and endovascular division. There, she was promoted to tenured professor, served as vice chair for research in the Department of Surgery, and was later appointed as the executive dean of research, research education, and innovative medicine for the UM Miller School of Medicine. In 2015, Dr. Velazquez was appointed after a national search to chair the Department of Surgery at UM and made history, becoming the first Latino woman chair of surgery in the United States. She was also named the inaugural Surgeon-in-Chief at UM's health system and served as Chief of Surgery for the Jackson Memorial Healthcare System. In these roles, she concurrently served as the leadership interface for the UM and Jackson Memorial Surgical, Clinical, Research, and Education programs, both at UM Jackson and at the Miami Veterans Administration Hospital. Through her 15 years of executive leadership at UM and Jackson Memorial Health Systems, Dr. Velazquez was the trailblazer servant leader behind dozens of thriving clinical care lines and education programs, thousands of medical, surgical, and research trainees, and hundreds of surgeons, scientists, educators, allied healthcare professionals, and administrative team members. And I'd like to note, very much beloved by all of our general surgery residents in the department. Regional and national reputational ranks rose under her watch, establishing for the first time in its history the UM Department of Surgery as a top-tier national academic department of surgery. Throughout this time, she cared for thousands of patients suffering from cardiovascular diseases and diabetes in South Florida and beyond. She inspired the vascular research team towards a promising new field of vascular regenerative medicine, resulting in several UM-owned intellectual properties credited directly to her multidisciplinary and collaborative research laboratory. In recognition of her service, grateful families and community pillars donated funds to the University of Miami for an eponymous endowed chair honoring Dr. Velazquez, and she was subsequently named the 2021 Latina Pioneer of the Year. Dr. Velazquez is a member of the American Society for Clinical Investigators, the American Surgical Association, the Southern Surgical Association, which she served as treasurer, the board for the Academy of Science, Engineering, and Medicine of Florida, the board of the Jose Marti STEM Academy in Union City, New Jersey, and the National Academy of Medicine. Among many other illustrious organizations, Dr. Velazquez also serves as Distinguished Fellow of the Society for Vascular Surgery, Society of University Surgeries, and Associate Editor for Rutherford's Vascular Surgery and Endovascular Therapy textbook. She has been continuously funded by the NIH for over 20 years, published over 200 manuscripts, served on multiple scientific review panels and study sections, and obtained several biomedical patents. One of her seminal discoveries was licensed by the University of Miami, leading to a new incubator company that is advancing new vascular cures through novel gene and cell-based approaches, Ambulero Incorporated. Some recent recognitions include a Certificate of Leadership from the DeWitt Daughtry Family Department of Surgery, the Conrad Jobst Award at the University of Michigan, the Rudolph Matas MD Vascular Surgery Award from Tulane University, the Distinguished Alumnus Award from Rutgers, New Jersey Medical School, the Distinguished Graduate Award from the University of Pennsylvania, and the Miracles for Life Leadership Excellence Award by the Life Alliance Organ Recovery Agency. It's my pleasure to introduce Dr. Omaida Velazquez. And to start off, our first question is for Dr. Velazquez. Can we start off just by talking about your overall background? Where do you come from and why did you choose medicine? And then specifically, why did you choose vascular surgery as a career?
Thank you, Dr. Huerta, for that wonderful introduction. I just unmuted myself. Apologies for that. It's wonderful to see Dr. Huerta, one of our research mentees and a superstar that one day will accomplish a lot more than we ever could ourselves. So thank you, Teddy, for the warm introduction. I also want to thank the Latino Surgical Society, Dr. Molina, and Dr. Hernandez, Alexander Hernandez, for the opportunity to be there, as well as the wonderful team that we don't all see on view here that's making this venue possible. So I want to get started by answering your first question, Dr. Huerta, which is, where do I come from and what led me here with these career choices. So I was born in Cuba, in Pinal del Rio, Cuba, in the rural part of that area, which is towards the west side of the island, a little town called Piloto. There's a running joke among Cubans where you don't want to admit that you're from Piloto because it will question your academic cognitive background, and that speaks to how rural it was and how under resourced it was in terms of education. And in 1980, I had the blessing and the opportunity to sort of restart my life here in the United States as a political refugee in Union City, New Jersey, which at the time was the second largest Cuban settlement in the United States, the first one being Miami, of course. And I went there because I had family there that had immigrated in the 1960s. And they received us with open arms and great joy, and they sort of allows an opportunity to get started within the culture and the system in the United States. And there I attended Union Hill High School, and I had the great fortune of meeting an amazing woman. Her name is Nadia Macard. We've remained lifelong friends. And she was my math, physics, and chemistry teacher. And I shared with her my desire to become a medical doctor. And she was the only one that would look at me like I didn't have 10 heads when I said that, because, you know, I had arrived, I did not speak a word of English. I was completely a fish out of water as far as the American culture went. And the only thing that I had going for me was that I was strong in the STEMs, you know, so I had taken a STEMs placement examination to enter the bilingual program at the public high school, and I placed 1 year ahead of my grade level. So I had that advantage. And so what I did with that 1 year ahead was to catch up with all the English courses. English and history was sort of my overload. The STEMs I continued, of course. And that allowed me to ultimately enter at Stevens Institute of Technology for first biomedical engineering and subsequently a transition to biomedical sciences, so I could meet my prerequisites for applying to medical school. I was fortunate to do well at that college. It was at the time the fourth ranked general engineering college in the nation, but they were a pyramidal program. So I remember one of the first classes, I'm in an auditorium of over 500 people, and the professor says, look to your left, look to your right. You're not going to see those people at the end of the year. And I was horrified, you know, because we had really stretched as a family to pay for my digital computer, which was mandatory to enter the class. It was the first year that a digital computer was mandatory to enter a college class in the United States. And I thought, OMG, you know, if I don't make it through this year, I'm in trouble with my family and my dream of becoming a doctor. So fast forward, I did okay. I did really well during those 4 years, and I was able to obtain a state merit-based scholarship to go to medical school at New Jersey Medical School. And, you know, and I thought that was just unbelievable that it was really the American dream to be able to go to medical school in your state school, and to, on top of it all, be given a little extra help, right? You know, for getting good grades in your classes. And so between the scholarship and me commuting, I didn't stay, it was a commuting school. So I was able to go through medical school, and my family was able to afford that. And my sort of goal was to get an A in every class, and that's what I did. It was my sort of thank you, America, for helping me in this way. And once that was done, I was fortunate to match at the University of Pennsylvania, as you mentioned, where I did all of my surgical training, both in general and vascular, and also my postdoctoral research training. And I say, you know, without hesitation, if I had not met Nadia Makar, I would not have been able to navigate those choppy waters, if you will, because everybody I spoke to said that's just a pipe dream. That's not feasible. Why don't you think of this or that or the other thing? And they would list the professions that I could look into. But you know, she said, actually, you're good in the stems. You know, you could do this. And one thing I did not have going for me was I didn't have good standardized testing going for me, because I took the SAT entry, you know, standardized testing for college. At the time, I didn't even know the language. And the bulk of the math questions were in terms of cards and, you know, like the American card system and this and that and the other thing. And it was like, as foreign can be. I had no clue. So I didn't have that going for me, but I had one mentor who thought, looked at me and saw a little bit beyond the surface, if you will, and thought I could do it and pointed me in the right direction. And so that's how I ended up becoming a surgeon.
It's a really incredible and exemplary story, and I think touches on so many commonalities that Latinx individuals face when starting their surgical careers, and particularly when immigrating to the United States, and the type of resiliency and hard work that it takes to really do excel in your educational journey. And can you share with us a little bit? I know you touched on it, as particularly what motivated you during your early years in Union City, especially when facing limited resources, and how that kind of shaped your approach to your surgical career as well.
Yeah, I mean, the thing with limited resources is that it surfaces in so many ways, right? You need a computer to start your first year of college. You need a special Texas Tech calculator to do your last year of high school. And take the SATs, you know, and you kind of wonder, how am I going to be able to have access to that, right? When those resources are not there. And so, you know, it really requires to step back far away from the front line of the situation, the dire straits of the situation, and say, well, this is one opportunity, that's another opportunity, that's another opportunity. So, and how do you couple all of those opportunities into something that creates a feasibility line? So I knew I wanted to dabble a little bit, learn a little bit about science, right? And I knew that I would need to, you know, have that experience under my belt to be strong, you know, qualifying for medical school applications. So I asked Nadia, you know, are you aware of any, you know, summer research programs that might offer a little stipend? You know, because God knows I need a little stipend. You know, and she was able to make contact with New Jersey Medical School at the time, a professor by the name of Michael Lee in biochemistry. And he was accepting summertime students, and he was willing to accept me into the program. And that's how I sort of got started in learning a little bit about science, but also having a few resources to get some of the basics that were needed to keep going. And that speaks to the issue of the link of mentors. It's not just one mentor or one sponsor or one role model throughout one's career. It's a series of good individuals that somehow, you know, God or nature or a higher power or whoever one believes in puts in our path. And you have to be willing to recognize them and listen a little bit, even when you're not quite sure if what they're saying, you know, meets your needs, and follow their lead a little bit. And that's what I did. You know, I followed the lead of Nadia Makar and Dr. Michael Lee, and I got started to learning a little bit more about science, and it's just one thing led to another. And I was thinking, in medical school, you know, what am I going to do as far as a global career, you know? And it was very hard because I liked everything. And since I had sort of given my internal goal of getting honors in everything, it was even harder because, you know, I took a deep dive onto every subject, whether it was psychiatry or internal medicine or radiology or ophthalmology, or, I even took an elective in allergy and, so on and so forth. And so what I ultimately decided to do is look at myself in the mirror as an introspective exercise and ask myself, who do I see? Do I see an internist? Do I see an allergist? Do I see a pediatrician? Do I see a surgeon? And I would repeat that morning exercise over and over and over and attach it to what I saw happening in the hospital during my rotations, to see if I would sort of click with anything. And I went through the roster. I wanted to be everything at some point, but it was ultimately a very easy decision. Really, I see a surgeon looking and staring back at me. That's what I want to do. I want to do surgery.
Excellent. I think, yeah, that's a lot of very similar experiences that individuals face, and I think it's really speaks to your resiliency and grit overall to come through those experiences and excel so wonderfully. And I also appreciate the fact that I remember you brought up that you struggled with standardized testing originally, because I believe, if I'm not mistaken, you won the AppSite Award a couple years in a row while you were a resident at the University of Pennsylvania.
Once I had the language and beyond the language, a little bit of culture, right? Under my belt, if you will, it was easier to handle standardized testing. And so the app sites were a big thing at University of Pennsylvania. They really insisted that fund of knowledge was the beginning of everything to become a complete doctor. And every surgeon should be a complete doctor. So your fund of knowledge should be robust. And so I paid a lot of attention to the outside. And as you know, once I moved on to leading programs, I sort of, in not so subtle ways, sort of wanted others that come in the training line of surgery to pay attention to the outside as well. And I wanted to pass that along because it's really served me well as a complete doctor, because regardless of what you ultimately super specialize in as a what the day-to-day care of a patient, all that fund of knowledge of that huge pyramid underneath the tip of the iceberg is going to come to bear in how you assess that patient and how you think of the things that are not common, and the differential diagnoses that are not expected, or the presentations that are coming from left field. And I have been in many circumstances where patients and family absolutely appreciate that, and it's such a sense of well-being to know that I, as a doctor, can offer that. So I've always paid a lot of attention to fund of knowledge, regardless of specific practice, global medical fund of knowledge. Yes, the app side was one of my things I did. And remember, I trained before the 80-hour week, so they were not, other than the 36-hour shifts with every 3 nights or every other night on call, there was not a lot of hours left over to read a book. When I was training as a surgeon, but somehow I thought it was important to me to pull out those books and keep cramming in that knowledge into the brain as I went through my years of general surgery training.
Excellent. And then, speaking to your general surgery training too, could you maybe discuss a pivotal moment or any mentors or specific moments that really during your training influenced your career trajectory into vascular surgery specifically?
Yeah, so it turns out, and for those of you that know me well, you'd be surprised because I don't often change my mind. I am a kind of like a turtle, sturdy as it goes, kind of a thing. And so I don't deviate from the established course often, but I was going to be a surgical oncologist. When I looked into the mirror and I saw a surgeon looking back at me, I thought, I see a surgical oncologist that one day will cure cancer. That's what I saw. And so I'm thinking, you know, surgical oncologist. Talking to Dr. Doug Fraker, one of my mentors at Penn when I was training, Dr. Daly, another one of my mentors. I have everything lined up. My research was in colon cancer metastases with Dr. John Rambeau, and all of my mentors were gonna write me letters of recommendation to apply for a surgical oncology fellowship. And then I come out of, so I did 3 years of clinical surgery. I do 2 years of postdoctoral research training at the Harrison Department of Surgery. And then I start with my PG4 clinical rotations. And the first rotation I take is vascular. You know, there is a number of iconic names, some of whom have already retired, sort of be my teachers, like Dr. Ron Fairman, Dr. Jeff Carpenter, Dr. Michael Golden, Dr. Clyde Barker, and they're like my teachers, and I'm rotating with them as a clinical surgeon, PGY4 in training. And my goodness, I just couldn't stop eyeing the back table. It was the beginning of the endovascular revolution. Suddenly we didn't only have you know, scalpels and everything else that goes with it, but we had catheters, and we had all kinds of widgets and gadgets, and they were all there for us to play with. And you can not only get to the area that you needed to reconstruct with a direct approach, but you can get to it traveling through the inside of arteries and veins. And it was so science fiction, and boy, was I smitten by the concept of vascular surgery at the time. And I couldn't believe it, because I was like, no, I'm not gonna change my mind. I'm a surgical oncologist, so I couldn't believe it. So the rotation is a month, and I'm done with it in the blink of an eye, because I'm enjoying it thoroughly. And the vascular fellowship application is an early application, so you have to submit, you know, in your PGY4 year. And I'm in a little bit of a bind, because everything's been set up for Surg Onc and not for vascular. So a good friend of mine, you know, Joe Gorman, is a co-PGY4 general surgeon with me, training with me at Penn. And I said to Dr. Gorman, I said, Joe, you know, I need another month of vascular, because I'm going through an existential crisis here. You know, I think I may need to become a vascular surgeon instead of a surgical oncologist. And I don't know for sure. I have to, you know, learn more. And you want to be a CT surgeon, and I think I may want to be a vascular surgeon. You want to swap our months. So I was supposed to start the CT surgery rotation. He was supposed to start the vascular rotation. And Joe is like, another CT surgery month? Sign me up. So that's what we did. We swapped, and we were lucky enough to have a very wonderful, you know, program director that was accommodating, Dr. Jim Mullen at the time, that was accommodating to us trying to explore those possibilities. And at the end of the second month of vascular rotation as a PGY4, I knew I wanted to be reconstructing aortas, and I wanted to be reconstructing carotids, and I wanted to learn everything there was about endovascular catheters. And that's how I switched my career at the drop of a dime, and beyond all kinds of, I was horrified. I didn't know I was capable of doing those fast changes in life.
Well, very luckily for the field of vascular surgery, you made that decision, and that field has definitely benefited from that as well. And to kind of pivot as well to your later leadership roles, and really, you know, this as you became the first Latina women chair of surgery in the United States, what do you think your most significant contributions to the field have been, both in vascular surgery and really advancing the field and access and leadership roles for other Latinas and women? And what advice would you give to women pursuing leadership roles in medicine and surgery?
Yeah, that's a tough question, you know, to pinpoint the most significant contribution, right? Because, you know, you're talking about decades of work, and it's hard to sort of pinpoint one. I think if I'm to think of it globally, probably the most significant contribution is what I've passed down to surgeons in training, and particularly academic surgeons in training that have come through my research lab, Teddy, you know, and you're familiar with that path. You know, we as mentors fly in and fly out, you know, when needed, in the process of teaching the next generation, whether it's taking them through a case or whether it's taking them through a scientific dilemma that needs to be unraveled, an unsolved problem that needs to be studied. And I think probably my most significant contribution, perhaps already able to be measured today, but perhaps most importantly able to be measured, say, you know, 50 years from now, 20 years from now, 30 years from now, is the next generation. You know, for the longest time, I wondered, once I'm done with the University of Pennsylvania, will I, you know, with the general surgery and the vascular surgery training, will I go into private practice or will I go into academia? And there was definitely a part of me that wanted to solve problems, right? And to do research and all that. But that was not the main reason I went into academia. The main reason I went into academia is because I thought, wow, wouldn't it be nice to be a part of the trajectory of the next generation of surgeons? You know, and that's why I stayed in academic surgery, because of that sense of how wonderful it is to, whether it's a small nugget or a big, you know, philosophy changing approach, to be able to transfer that to the next younger generation, that one day will take care of us and our kids and our grandkids, that one day we'll be able to come up with new cures, and you know, that one day we'll be able to maybe influence society towards a better trajectory. And so I think probably that would, I would say that's my greatest contribution. I'll give you a little bit of a nugget about that, a specific example. When I was being inducted at the National Academy of Medicine in Washington, D.C., you know, just recently, I'm there with Dr. Kathy Gallagher, right? And Dr. Kathy Gallagher is being inducted same year as I am. And she was my mentor, my mentee in the research lab at Penn for 2 years. And I'm thinking to myself, not only that I'm happy that I'm being recognized by colleagues to be inducted into this important, you know, scientific academic society, but I'm thinking to myself, I cannot believe that Kathy's here being inducted with me. That I would, you can one day, if you interact with Dr. Gallagher, who's a full professor, tenure and fully funded by the NIH at the University of Michigan, you can tell her how much I bugged her during the dinner and everything else, the entire meeting, because I would say, Kathy, I need you to meet this person, and Kathy, and I kind of felt like I was doing the networking after, you know, my research residents would finish their talk at a national meeting. You know, I was sort of bringing Kathy into everything that I did, and to me that was very enjoyable. To me, that is passing it on feeling that is just absolutely unbeatable. So yes, my trainees are my greatest contribution. I hope that will be my legacy.
Absolutely. And I think, because, you know, so many, myself included, trainees have benefited from your wisdom and mentorship and guidance, and just seeing your ability to lead and really produce such a really groundbreaking vision, both for the Department of Surgery and for your own research and ability to really make differences, both in the overall field of vascular surgery and in American surgery overall. And then one final question, just to ask before we open up the questions to the audience. Reflecting on your, you know, your career and your numerous accolades and recognitions, what do you think has been the greatest obstacle in your career advancement? And what do you think of those things has been the most satisfying to overcome, or, you know, the recognition or accolade that you are the most grateful for, or feel the most connected to now?
Yeah, you know, I think that probably the greatest obstacle for Latins across America is that they need to figure out a recipe to have people look beyond the surface. Look beyond the name, look beyond the accent, look beyond their height or how brown their skin is, or how curly their hair is. Look beyond the surface and recognize and respect the contribution, the talent, the nugget that is there at the core. And I'm gonna tell you, that doesn't come automatically for anyone, but particularly for Latinx members of the Latinx community, because we just don't have as many of them. So we need increased representation from our culture, so that people can grow up in elevators where, the professor elite, the doctor amazing, the go-to surgeon amazing, is this Latinx member of the community, right? And once they grow up in that elevator, then the surface stops being a barrier. And so I think that if one recognizes that, then it's easy to go to the next transition, which for me is my philosophy that respect is not automatic, it's not a must, it's not given, respect is earned. And so in order to gain and earn respect from people, you need to show them what you can bring to the table. And that goes back to a little bit of what I mentioned to you, when I went to medical school, I had a target for my grades. When I went to residency, I had a target for my absides. When I went to my first 8 years of the career, I had a target of when I wanted to be NIH, how fast I wanted to be NIH funded, and how strong I wanted to be within the first 8 years, and so on and so forth. Because I was in a very deliberate, intentional path to earn respect. And that takes a lot of muscle, a lot of work, a lot of grit, a lot of perseverance and persistence, and a lot of looking the other way when superficially, at first glance, people look at the surface and dismiss you. So I think that's an important message that I like to pass along to my trainees. Do not expect that you're gonna be a 5-foot-tall Latin surgeon going into the operating room at a county hospital, and they're not gonna confuse you with somebody else accidentally. Do not take that as an affront or as a hostile sign. It doesn't happen at a conscious level. It happens at a different level, and we all need to be aware of it and sort of be part of the transformation of society moving forward, so that those kinds of things happen a little less and less, as we grow in America.
Thank you. I've learned so much, and what I've also learned is that surgical oncology really lost a great surgeon that could have joined our field. So it's interesting to see how you changed your interest in fields, but surgical oncology definitely had a loss there. I'm gonna pivot now to questions from our audience, and we have two really good questions. I'm gonna ask the second one first, and it's were there any challenges you faced as a woman in surgery, advancing through your career and leadership journey? How did you overcome these challenges, and what advice do you have for future women interested in surgery?
Yes. So being a woman in surgery sort of puts you into that category where there isn't as much representation yet. So patients don't see as many women surgeons as they do men surgeons. Families don't see as many women surgeons. When you ask some of our AI systems, to talk about a surgeon, they'll have a he, not a she in front of them. And it just speaks to the not any malice or any intentional issue. It speaks to the commonality of the lack of representation in the field. And so until we have, so we have 50-50 medical students graduating at the top of their class. And so one day we should have 50-50, medical and surgical distribution. But right now it's much less than that. And so people don't think of women as surgeons. Is not the first picture that comes to their mind. And so I always tell the women that come to me and ask me, about the idea of becoming a surgeon, and all the common questions are, will I be happy? Will I be accepted? Will I have a normal life? Will I be able to integrate my life between work and personal interests? And the answer is yes, yes, and yes, and yes. All of that is absolutely feasible. It's not feasible through sort of putting our head in the sand and not acknowledging that some of these challenges are going to be there along the way. So denial is not the feasibility pathway. Acknowledgement is a feasibility pathway, and then adapting techniques to manage some of the challenges, some of the obstacles. Philosophies, overarching philosophies, like what I mentioned before, the idea of, starting from the fact that you always going to have to earn respect. Respect is not going to come to a woman surgeon if they don't show up like the classic idea of a surgeon in the OR, right? And so you cannot expect that. But then there's techniques, and I've had some mentors. I remember chatting with Dr. Julie Fleischlag, who's extremely well accomplished academic surgeon in American surgery, and she would say things like, well, I always introduce myself when I go to the operating room. I'm Dr. Fleischlag, I'm the chief of surgery here at Hopkins. And that way I don't allow for the opportunity of people mistaking me for someone else, whether it's the circulator or the tech or the nurse or whoever, and then feeling embarrassed that they don't know who the chief of surgery is. So I don't even allow for that, next step to happen, because I know it's going to happen. So I will adapt techniques like that. And so the path is recognition and adapting philosophies and techniques to manage some of these implicit biases that are there. They're there in every human being, not because human beings are faulty in any way, it's because human beings are human. And much like an AI, we make generalizations, based on our experiences. And our experiences are filled of examples of surgeons that are amazing surgeons that don't happen to be women, because we don't have as much representation in the field yet. So I tell my medical students and undergraduate students, and some even high school students that come to me asking about medicine and surgery, I tell them, absolutely, you're going to love it. It's going to be the most amazing career ever. And then I give them some practical tips, as to what to maneuver what when the time comes, so that they're equipped with the proper tools. But I really mean it. I think being a surgeon and being an academic surgeon, and beyond that, being a vascular surgeon, is the best career I could have ever chosen. I've enjoyed it thoroughly. I still sort of enjoying it and feel like I'm contributing. And I highly recommend it to anyone, but particularly for women. There's a number of talents that women have that are very, very well honed. Whether it's their small hands, whether it's their steadiness of their approach at assessing issues, and connecting all of the things that are important before making a decision. Whether it's that sense of love that we automatically connect with our patients and our families, we bring that. And not to say that others don't bring that, they do, but there are some natural instincts that are very female that we bring to the field that enriches the field. And our patients notice. At least my patients have always noticed, whether in Philadelphia or Miami, and they've always told me, and beyond telling me they've gone out of their way to, when they have the means, to fund my programs, to let me know how much they appreciate my female touch to what I do.
Thank you. That's it's very enlightening, and you answered our the first question as well. What advice would you give to students? There's a third...
simple advice: go for it. You're gonna love it, but plan ahead. It takes some management.
There's a third question, which I think is an interesting question. And it says whether there have been times where our other fellow Hispanics, Latinos, patients, colleagues didn't think you were a surgeon or a doctor. And I guess, you know, did that ever happen? How did you manage that? I think maybe the member here is trying to just kind of, gauge, whether there might be some bias even within our own communities.
It's a good question, and I think that the answer lies within the fact that there isn't any sort of inherent malignancy to implicit bias. Everybody from every community, every gender, every walk of life has. And I've come to sort of look at it as a way in which our minds generalize the majority. Because you gotta, in order to function, you have to generalize the majority. Otherwise, you can't function. If you bog down with every exception every single time, it's impossible to be effective in life. And so, absolutely, I have never, ever had someone that doesn't know who I am look at me and think I'm a surgeon. Definitively. And so it doesn't matter whether they're Latin or not Latin, male or not male. They simply, on the surface, I'm not your typical surgeon. And that's okay. Actually, I kind of grew to like it. Because then you tell them as you get to know people a little bit more, and they just have this like, aha moment. And it's okay. It's very enjoyable to see people have the aha moment.
And then one last question from the audience, and then I'll turn it back to Dr. Huerta. This is from Francesca Bosa. And I also think it's a great question that I actually had in mind as well, and I'm glad it was asked. Between the increasing clinical demands and shortage of physicians, plus the reduction of NIH grants, how do you envision the future for incoming surgeon scientists?
It's a huge challenge. Thank you, Dr. Bosa, for that important question. And in full disclosure, Dr. Bosa is also one of my postdoctoral research mentees and a superstar. And at least for now, until she sees the light otherwise, a CT surgeon of the future. So I think, it's a challenge, and the societies, the field, the house of surgery realizes this is a challenge, the sustainability of the academic piece within academic surgery moving forward. Because everything is pulling away, right? You have the pressure of the clinical work RVU and financial sustainability that comes to the systems. From that, you have the pressure of the time that it takes to teach surgeons to become surgeons. And then you have the pressure of the unsolved diseases and patients wanting better cures, right? And who better to come up with better cures for surgical problems than the academic surgeons? And those three pressures are vectors sort of pulling in opposite directions with people's time and resources. So it's a real big issue. The American Surgical Association put together a team of leaders from the top 20 departments of surgery, according to the NIH Blue Ridge ranks in the United States. I was fortunate enough to make it to that elite group of individuals, and I was part of that task force looking at sustainability pathways, and we did publish recently published a white paper on the topic with recommendations. How do we maintain research sustainability within academic surgery with all of these pulling forces that are not congruent. And it really is multifactorial, but at the core of this pyramid is the institutional commitment. The leadership at the top of academic surgery departments need to value the investment in academic surgery. And surprisingly, that's increasingly very, very difficult, because the field of surgery as clinical care goes is a financial sustainability piece of the academic medical center at large. And what that means is that when a surgeon dedicates time for academic pursuits, not only is their academic pursuits perhaps not fully funded, but in addition to that, there's a missed opportunity factor. That surgeon could be doing 500 bariatric surgeries, that year instead of 300, because they decided to do these academic pursuits. And so that's 200 delta, and I'm not picking on bariatric surgery, I'm just pulling something out of a hat. But that delta of 200 is a missed opportunity for the academic medical center to create more financial sustainability. And so why would they want that? And that trickles down to the answer, they don't want that. And that trickles down to the answer, they don't support that. And that trickles down to the answer to Francesca's question is, who's going to pay for it if nobody wants it? And so it is a real challenge. And it does require a comprehensive assessment by the House of Surgery as a whole, and particularly by our representing institutions like the American College of Surgeons, like the American Surgical Association, and so on and so forth, to say, what are we going to advocate for? What are best practices? Because when you think about what surgeons have contributed to patients to date, and I'm just going to pick a few just randomly. TPN, Dr. Jonathan Rode. It's not even thought of as a surgical discovery, but it saved millions, and it makes a difference across every aspect, every field of care, right? When you think about endoscopy, it's not even thought of as a surgical development, but again, is everywhere now. Minimally invasive procedures, catheter-based procedures, not thought of as surgical innovation, but is permeating everything. It started with vascular and moving into cardiac and moving into thoracic. It will soon be in oncology. Many aspects of oncology are now being addressed catheter-based. And it will continue. So there are transformative innovations that have come from the surgeon's mind, if you will, because they know the diseases, they know the natural history, they know the patients, they suffer together with the patient and their family when the standard of care surgical approach is not good enough. And they put their muscle into making the next step of progress. And then it doesn't matter who owns it, if you will. It's just there for patients to derive benefit from. But I think that the reason, if there's any reasons to say we need to keep surgeons in the loop of academia and discovery, is the patients. And the cures for ourselves, our kids, grandkids, and great-grandkids that we don't have right now. Because yes, surgeons are amazing with our hands, right? And we go in there and we do a miracle, one patient at a time, and we leave and we feel like we're on top of the world when we tell the family, patient, your loved one did well, everything went as planned. We reconstructed everything that there was to reconstruct, or we took all the tumor that there was to be taken out. Yes, that's true, but we also have the fund of knowledge to come up with ideas for the next set of cures. And we don't want to give that up. If we give that up, it'll be a great disservice to society. But the forces right now are telling us, give it up because we need you to go and do more procedures. And that is a misaligned incentive. We have to cushion ourselves against that.
Very, very powerful. Thank you.
Excellent. Thank you so much. All right, Dr. Velazquez, just some last rapid fire questions. What is your least favorite word?
I guess it's and it gets me in trouble when I text because I always omit the I out of every text, and it confuses people sometimes.
What sound or noise do you love?
The ocean. I love the sound of the waves and the ocean. Very relaxing.
Oh, and the ocean. We get a lot of that in Miami, which is good. What is one of your distinctive operating room preferences?
Oh my gosh. For anybody that has operated with me, paradoxically, as complex as a case I can do, my one pet peeve is that the bandages and the closure need to be perfect because that's what the patient and the family see. So I insist in very fine cosmetic subcuticular sutures and the most gentle bandages that you can ever buy, or the hospital will ever let you buy to prevent blistering or pain when you remove the bandage. That's my pet peeve.
Do you have a favorite joke?
I'm not a very jokey person. I'm trying to think of something I've heard that sort of made me chuckle. Oh, what is the difference between a specialist and a generalist?
What is it?
Well, the generalist will treat you for what you have, but a specialist will treat you with just whatever they got. Hammer.
Love it.
Oh, okay, I got another one. All right, so what do you say to a patient, Teddy, that comes to you and says, every time that I eat some birthday cake, I get a horrendous heartburn, doctor? How do you advise them?
I don't know. What do you say?
Make sure you remove the birthday candles.
That probably has happened at some point in
Sorry, bad jokes.
No, I love it. What is your favorite thing about the operating room?
The teamwork, definitely the teamwork. I love the order, the protocol, the steps that are orchestrated. I love being in the operating room. It's the most amazing safe zone. You're focused on one person and one person only. You're there to deliver the most important aspect of that person's life, a flawless procedure. And there's such a protocol to it, and everybody counts. Absolutely everybody counts. I love that protocol and that sequence and that order to the operating room and that focus on just the patient at hand.
And then on the flip side, what is your least favorite thing about the OR?
I don't like messy fields or bloody fields, which might seem paradoxical in a vascular surgeon. I do not like the sight of blood. So you will see me being particularly meticulous about my hemostasis, about the way the edges of the field look, about suctioning the field perfectly dry at every point of the procedure. Stagnant blood or messy splatter blood, I have a reaction against it.
And then just a couple last is, what profession other than being a surgeon would you like to attempt?
Definitely writing. I love writing. And I thought if I didn't become a medical doctor, I'd probably become a writer.
And then lastly, what is the best gift you've ever received?
Wow, I've been so fortunate over the years with such amazing people that have taken me into the fold and have loved me unconditionally, from both, you know, family and friends, and also professionally, and from patients and family. Is really a tough to pinpoint one. I say a couple of years ago, I got a very memorable, most special gift from Rebecca Kramer. She's one of the nurse practitioners that work with us in the vascular surgery clinics, and she also is a member of the Air Force and a nurse in the Air Force, and she's been deployed a number of times during the pandemic and thereafter. And she gifted me a flag that had been flown over Afghanistan during one of the freedom operations. And it was flown in my honor with like the flag as well as the special authentication certificate. And I really was moved by that gift, because, you know, I could have still been in Cuba, and I could have never had this trajectory of getting to America and the land of opportunity and the freedom and all of the amazing things that have happened to me in the second stance of my life here in the United States of America. And that gift that Rebecca presented to me was symbolic of the sacrifice that goes into the American lifestyle. And it's easy to take it for granted, and it's easy to criticize it, and it's easy to say this is not perfect or that's not perfect. But not so. It's precious, is unique, and is wonderful, and we should not take it for granted, and we should appreciate it, and we should fight to keep it that way for next generations, and to make it even better for next generations.
Thank you. I would like to thank you, Dr. Velazquez and Dr. Huerta. Thank you, Dr. Velazquez, for joining us for our latest installment for Inside the Operating Room. I'd like to thank all of our audience members. I apologize we couldn't get to all the questions. I think this was a very lively session. I think we should have you again, Dr. Velazquez, for part 2. I would also like to thank the people behind the scenes. Aldo Trevino, who is the Latino Surgical Society webmaster, makes all of this happen. Kristen Huerta, who's a Latino Surgical Society social media intern, and also to our 2 co-directors who make all of this happen. They're the 2 co-directors for Inside the Operating Room series, Dr. Oscar Sarirosa, who I'm proud to say just matched into a preliminary surgery year at UT Southwestern. He's a surgeon from Chile, and Dr. Alexander Hernandez, who you know very well, Dr. Velazquez, at University of Miami. So thank you to the team that makes this possible. And last, and in closing, if you're interested in learning more about the organization or becoming a member, you can find us at latinosurgicalsociety.org. And we're also on various social media channels. And this recording will be posted on YouTube channel, and you can see all of our other recordings as well. Buenas noches a todos. Muchas gracias. See you next time.
Muchas gracias. Thank you, Latino Surgical Society. Thank you, Dr. Huerta and Dr. Hernandez. Thank you so much, Dr. Molina. Appreciate it very much.